What happens when the very institutions meant to protect us might be hiding dangerous secrets? Across the UK, families are demanding answers as accusations mount against several NHS trusts. The charge? Prioritising cover-ups over patient safety, potentially putting countless lives at risk. This isn't about minor errors. We're talking about avoidable deaths, botched surgeries, and, honestly, a chilling disregard for human life. The evidence is mounting, and it paints a disturbing picture of an organisation grappling with systemic issues. It's time to shine a light on these alleged cover-ups, to understand how they happened, and crucially, to prevent them from happening again. University Hospitals Sussex NHS Foundation Trust. It sounds like a beacon of medical excellence, but behind the facade, a storm is brewing. Sussex police are currently investigating a staggering 90 suspicious deaths at one of their hospitals, the Royal Sussex County Hospital. These deaths, spanning from 2015 to 2021, are now the subject of a potential manslaughter investigation. Whistleblowers, those brave individuals who risk their careers to speak out, allege a culture of fear and intimidation within the hospital. 2 surgeons who dared to raise concerns about patient safety were subsequently dismissed. Their alleged offences: voicing anxieties about unsafe cost-cutting measures, the promotion of unqualified surgeons, and an over-reliance on temporary doctors. If these allegations are true, they point to a systemic failure, a silencing of dissent that could have deadly consequences. The human cost of these alleged failings is starkly illustrated by the tragic story of Ken and Margaret Volder. Ken, diagnosed with esophageal cancer, endured an agonizing 254-day wait for surgery, a delay that tragically cost him his life in November 2022. The trust admitted to failures in his care, citing administrative errors and internal disagreements. But for the Volder family, this admission offered little solace. As if one tragedy wasn't enough, Margaret, Ken's widow, also died under the care of the same hospital just a few months later in February 2025. She too had experienced delays in receiving crucial heart surgery. The Volders' story is sadly not unique. They are just one family, caught in a system that seems to have lost sight of its core values: care, compassion, and above all, patient safety. Sadly, the problems extend far beyond Sussex. In Nottingham, at the Nottingham University Hospital's NHS Trust, another scandal is unfolding. An independent review is currently investigating a horrifying 1,939 cases of potential harm to babies and mothers over a 10-year period. These cases, spanning from 2012 to 2022, point to a systemic failure in maternity care, a failure that has left families devastated. The common thread that binds these scandals from Sussex to Nottingham is the allegation of a culture of fear. Doctors and nurses afraid to speak out for fear of reprisal, silenced by a system that seems to prioritize reputation over accountability. Families are left grappling with unimaginable loss, their pleas for answers often met with silence or obfuscation. The question remains: how can we rebuild trust in a system seemingly riddled with such deep-seated flaws? The NHS needs more than a sticking plaster. It needs a...
The NHS is supposed to care for us, but sometimes a culture of cover-up takes over. This means hospitals hide mistakes instead of admitting them. Imagine a patient getting the wrong medicine because of a mix-up. Instead of telling the patient, the hospital pretends nothing happened. This is a cover-up. And honestly, this happens more often than we'd like to think. The Health Service Ombudsman, who investigates complaints, says there's a big problem. He says the NHS is too defensive. They would rather keep quiet than own up to mistakes. And this isn't just about paperwork. These cover-ups hurt real people. When hospitals hide their errors, patients don't get the right care. Families are left in the dark, wondering what really happened to their loved ones. This culture of silence needs to stop. We deserve a healthcare system that is honest and accountable. The consequences of cover-ups are devastating. Take the case of Christopher Walmsley, who died from a misdiagnosed blood clot in his lung. The hospital failed to act on clear warning signs. Then they tried to downplay their mistakes, leaving his family with more questions than answers. In another shocking case, a baby died after a delay in antibiotics. The hospital not only withheld crucial information from the parents for weeks, but also discussed deleting incriminating recordings. These are not isolated incidents. Countless families have endured similar ordeals, battling for the truth, fighting for justice, and struggling to come to terms with the loss of their loved ones, all while the NHS remained evasive and unaccountable. These stories paint a grim picture of a system that prioritizes self-preservation over patient well-being. Cover-ups don't just harm patients physically, they inflict deep emotional wounds on families. Imagine losing a loved one and then having to fight tooth and nail to find out why. The pain of the loss is magnified by the betrayal of trust and the constant struggle for answers. The NHS's defensiveness forces families to become detectives. They have to piece together fragmented information, challenge conflicting accounts, and navigate a bureaucratic labyrinth, all while grieving. This adds immense stress and prolongs their suffering. The emotional toll is immeasurable. Families feel betrayed, ignored, and re-traumatized by the system that was supposed to care for them. The NHS is at a crossroads. The government and NHS leaders are finally being urged to address this toxic culture of cover-ups. They are being asked to make honesty and accountability the cornerstones of healthcare. This means admitting mistakes, learning from them, and supporting patients and families affected by errors. It's time for a fundamental shift in how the NHS operates. There needs to be a system where speaking up is encouraged, not punished, and where transparency is valued over self-preservation. Only then can we rebuild trust and ensure that patients receive the safe and compassionate care they deserve. The time for change is now.
The UK's patient safety system is in crisis, and it's not a new problem. I'm talking about years of powerful inquiry reports, Morecambe Bay, mid-staff's moments that should have been turning points. But here we are. Over a decade later, many of the core recommendations still haven't been fully implemented. An expert panel from the Commons Health and Social Care Committee just gave the government a requires improvement rating. Think about that. We're not talking about a school report. We're talking about lives. Maternity outcomes are getting worse, stillbirths and neonatal deaths are up. And maternal mortality, up over 50% in just 5 years. There are massive regional gaps too. If you're in the northeast, your risk of an adverse safety event is twice as high as in London. And it's not just patients. Staff are under real pressure, burnt out, understaffed, and too often unheard. Here's the kicker. There have been over 500 patient safety recommendations from major inquiries since 2010, but there's no clear system to track if they're actually followed. Once the report is published, that's it. No follow-ups, no real oversight, just recommendations gathering dust. That has to change. If we're serious about safety, inquiry recommendations need independent oversight built into the system, not bolted on after the fact. Because the end of an inquiry shouldn't be the end of the story. It should be the beginning of real accountable action.
And the doctors treating you can't see your medical history because the computer system crashed. Sounds like a nightmare, right? But this is real, and it's happening in NHS hospitals across England. According to a BBC investigation, IT system failures have been linked to the deaths of 3 patients, and over 120 serious harm incidents. That's not a tech glitch, that's a crisis. Take this. 22-year-old Darnell Smith died in Sheffield because his care plan couldn't be accessed in time. Emily Harkleroad, just 31, lost her life in Durham when a critical alert never showed up. These are human lives, cut short by systems that were supposed to help, not harm. And it doesn't stop there. Over 200,000 medical letters went unsent due to tech failures. That includes 24,000 in Newcastle, and a staggering 400,000 lost in Nottingham alone. So what went wrong? The government's pushing for a paperless NHS by 2026, pouring £900 million into new digital systems, but many hospital trusts say the rollout was rushed, fragmented, and poorly designed. Nearly half of all trusts using electronic patient records reported problems. Doctors say they can't find patient info, meds get mixed up, allergies go unflagged, some even talk about a culture of cover-ups. And now, while systems are breaking down, NHS England is cutting over 9,000 jobs and being restructured to save costs. So here's the question. Is the race to digitize the NHS putting lives at risk? I'm not against tech. I mean, having your health info at your doctor's fingertips, that's the dream. But if we don't get it right, if the system can't be trusted, then it's not progress. It's danger in disguise.